Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back to the show, COIQ listeners. On today's episode, I have Lee Greene with me. He is the co-founder of Steward, and he's also the managing director for Health Inc. Welcome to the show, Lee.
Thank you very much, Dr. Roxy.
Good to have you here today.
Thank you. It's very nice to be here. I'm very excited about it.
I always like to start off the conversation with you giving our listeners and viewers a little bit of information about your background and, what's your role in the world of digital health innovation.
Great. So I started a long time ago. I'm a serial health entrepreneur. So I started back in the late 90s. I created one of the first web-based telepathology systems. And then I continued on that path for many, many years. And then I decided about 5 years ago to go on the outside of startups and to start helping founders and other entrepreneurs to develop their own startups. And then I got a call from my mother. So I was living in London at the time. And she told me that my grandmother had 6 months to live. And I didn't, for whatever reason, I didn't think that she had 6 months to live. So I booked a flight and I went to go stay with her. So she was living in Ohio with my aunt. And when I arrived, she was always the matriarch of the family. And so when I arrived, she told me, she said, "Lee, I'm going to be okay. I don't know what these crazy doctors are talking about." And so I said, "Yes, Grandma, I know." But then, so I slept in the bed next to her for the 2 weeks that I was there. And about halfway through the trip, she woke up screaming in the middle of the night. And then the next morning, she said to me that she had something to tell me. And I was like, "What, Grandma?" And she said that she's not going to make it. And I said, "Yes, Grandma, I know." And then she asked me about, is my mom going to be okay, etc. But then she asked me to make her a promise that I would use my skills to help people. Mm-hmm. And of course, she knew all about my long history in health startups and stuff like that. And so then it came time for me to fly back to London. And so I literally said the last goodbye. I left, I landed in London, turned on my phone, and I got a message from my father saying that she had passed away. Wow. And so I thought about it. And of course, I had to keep the promise. But, when you promise to use your skills to help people, that is very big. Where do you even begin? What? So, I didn't know. I didn't know what the problem was. I didn't know really where to start. She unfortunately had a form of dementia when she passed away. So I thought, okay, then there's something around dementia, and I didn't know anything about dementia. So I pulled together an expert team, and then Steward, my telehealth company today, was born out of that promise that I made to my grandmother. And then interestingly, I started coaching for an accelerator in New York City called eLab of NYC. And then I got a call from a colleague of mine in Europe, in the Netherlands. And so she said, "Lee, what are you doing?" I'm like, "Why are you asking?" And so she told me that there was a new joint venture between the Amsterdam Health and Technology Institute and the founders of Startup Bootcamp, which was going to be completely dedicated to digital health innovation and startup acceleration. And she asked if I would come on board and run it. And I said, absolutely, why not? Let's do it. And so that's where I am today.
What a great story. Grandmas are amazing. My 91-year-old grandmother lives with us, and she has for the last 2 years. And there's just something amazing about grandmothers. They see you, and, they don't see your faults and flaws. I've been very fortunate to have a grandmother that just thinks I'm the world and accomplish anything. And so she's got great plans for my life. My greatest cheerleader.
It really is amazing. I mean, grandmothers are incredibly encouraging. I'm also very fortunate to have fantastic parents as well. And so I remember my father always telling my brother and I when we were kids, and we would say, Dad, I can't do that. And he always said this phrase that really doesn't mean anything, but it meant something. And it was like, can't, never could. And we're like, okay. So they encouraged us to just keep going,
Some kind of way that was encouraging and motivating, right?
Good. Okay, well, here we go.
So you've been on an exciting venture and ride for quite some time now in the world of digital health innovation, both, being a startup founder and then in coaching and helping other startups. So I want to ask you, in all the time that you've been involved in this phenomenon, why do you think some health innovators succeed and some fail?
That's a very good question. And I think those that succeed really understand the problem that they're solving, number one, but also the flow of money. So the health system or the health industry that we're in is very complex, right? I mean, it's one of the few, if not the only industries, that has somebody that uses the product, somebody that recommends the product, somebody else that pays for the product. Mm-hmm. And I think that the startups that do succeed is they follow the flow of money, and they put themselves right in the middle of that flow, so they catch some of it as it's going around. Mm-hmm. In contrast to that, I think the startups that also struggle don't understand who's paying for what and where their company or their solution would actually fit into that flow of where that value is, that they bring value to.
Yeah, and I think that that's so fundamental. I can think of several conversations that I've had even just recently with innovators who are so excited and so passionate about what they've built and created, and they're kind of even in the weeds on all the features and functionality. And then after you go through that whole, kind of presentation or conversation, you go, okay, well, that's great, but who's paying for it? Yeah. And they're like, well, I know someone's going to pay for it.
Build it and they will come usually doesn't work.
Right. Yeah, exactly. And so, I think that's one of those examples of, maybe a great technology solution, but, ends up in what I call the zombie graveyard because mm-hmm. they just don't have a viable business model tied to it, which is a shame because it is something that could be really meaningful and change lives.
Yeah. Absolutely. But, I think, being a founder myself, I don't think, is that when you create something, and let me add that when, specifically in health, because founders tend to be very passionate about something, like there's really, like for me and my grandmother, and, so the founders and entrepreneurs that I have met, they all are driven by the good of it. Mm-hmm. And I think that's an extra challenge for them. And, the founders that we have in our accelerator as well, it's like, it's almost a bad thing when you think about making money. They think, but we're going to manufacture someone's liver, but why should we, somebody's going to pay for it because it's needed. So why, so it's really that kind of internal struggle. It's like, but we can't make money off of this, that kind of thing.
Right.
It's a very difficult, and it's I think very difficult also for health entrepreneurs to become, I don't want to say all about the money, but kind of all about the money.
Right. Either all about the money or not enough about the money. Reach into the spectrum instead of kind of, somewhere in between. Yeah,
I remember a conversation I had with a lady by the name of Paula Giolani, who is my personal advisor. And she's a very well-known businesswoman. She's on the board of directors of the International Committee of the Red Cross. She's on the board of directors of several publicly traded companies in Switzerland. And she was telling me that it is about the money. Every single entity, even nonprofits, will not exist if they do not figure out how to generate money. And that's how important it is. And I think that the health startups, to be successful, for all of you that are listening, understand the money, where it's coming from.
Start with that. Start with
that, yes.
Underserved market and who's paying for it before you even start building something.
Yeah. No, but that is really true. So going back to my grandmother as well. Now, that was the first time that I had built a company out of something so emotional, right? Yeah. So I also struggled with, where is the money gonna come from? Where is the money gonna go? And I also noticed with myself that because it was a promise that I made to my grandmother, I almost didn't care about the money, or I lost sight of the money because I wanted to help family caregivers who were caring for a loved one with dementia. That was my sole purpose.
Yeah.
And then I kind of spun my wheels in the beginning, and then I thought at one point, well, it's going to be the family caregivers that are going to pay for it. And then I was completely wrong. And so, even me, which I've been doing it for most of my life, when emotions get involved,
yes,
it also becomes very difficult.
Yeah. So I want to kind of peel a little bit of the layers around this. You mentioned you advise and coach healthcare startups. So, you're an expert in that area. And then you're also an innovator. And so, talk about what is the difference between all the advice and strategic guidance that you would give to other folks as maybe clients versus the difference of running your own company as far as like what you see and what you don't see, right? Because you would think, man, if you've been coaching hundreds of health innovators, startups, and helping them scale and grow successfully, like you should be able to like touch it, turn it to gold overnight because you got this. So what is that like?
Wow. So that's a very good question, because when you are building your own startup, you're blinded, and it's much easier being an advisor because and it was interesting because when I made the decision to go outside of startups and I started coaching for eLab, it's much easier to see as cliche as it might sound, it's much easier to see the forest because you're not emotionally involved.
Right.
One mistake doesn't affect my life, it affects your life.
Yep.
When you're in it, you have such incredible pressure, and I love entrepreneurs and I love founders because we have to go forward under extreme uncertainty, not knowing where the heck we're going. We think we want to go there. And so it takes a very special person, I believe, to endure the incredible pressure and the incredible uncertainty of being on the inside.
Yeah.
Being on the outside. So, in my role as the managing director of Health Inc., that is still a pretty stressful role. But I'm not involved in the individual startups.
Yeah.
And that part, yeah, so that's the big difference.
So I'll give you an example of what happened to me recently. So I have been preaching for several years now on the idea of product co-creation, and that the number one reason why health innovators fail is because there's not a market for whatever they're trying to sell, and the number one reason for success is product market fit. So I feel really strongly that one of the primary strategies to circumvent failure and reach success is product co-creation. So when you're co-creating with your customers, like, you should get to product market fit, like maybe no guarantee, but pretty darn close, because they are the ones that are helping you even at the idea stage all the way through. So I myself am an innovator, and I'm developing digital products, and I'm creating a co-creation workshop for all of the executives and founders and entrepreneurs that we work with. And I'm thinking, what are we going to do? We're going to do this. How are we going to do it? How are we going to create the offer? How are we going to package it? And I'm talking to one of my team members. I swear this happened just this week. And they said, why don't we actually co-create this co-creation workshop? Like, whatever we're teaching in the co-creation workshop, why don't we use that in the development of this? And I'm like, oh my gosh. I'm like, what a concept. Actually practice what we preach. It's so hard to see it.
Yeah. No, I mean, that is so true. And I've unfortunately had experiences as well with advisors that they haven't traveled the road, or let me say differently, they haven't walked in the steps of an entrepreneur. So, they can advise, but the advice I found can also be very, very superficial and unrealistic as well.
Yeah. That's true, right? So not just being a theorist, but a practitioner.
Yeah, exactly.
What a big difference, right? In the trenches and know kind of firsthand, different business, maybe different business model, but still nonetheless, knowing a lot of the inherent challenges that, we all face.
Yeah. I also, an entrepreneur and specifically a founder of a company, they will get a lot of advice from a lot of people. And I've seen founders also struggle with who do they believe? This person said one thing, another person contradicted what they said, and now I'm completely confused. Who do I believe? And I think learning how to really take in all of the external advice that you are getting and consider it, and then making your own decision is a very, very hard process to learn for founders, especially first time founders.
Yeah. So that's kind of gets to one of the other questions that I wanted to talk about was, as a founder and, entrepreneur, how do you know what moves to make, right? So you've got all those different advisors telling you all these different things. There's generally, can be some best practices on like the priority of that decision making, right? What comes first, what should come next, and all of these different paths, right, that you could take, because it's not necessarily where there's going to be this one right road and then all these other wrong roads. There's a bunch of them that could possibly lead to success, but it doesn't mean that one will get you there as fast or one will be as profitable. And so when you're coaching people, how do you help them understand what moves to make?
So that's a very interesting question, and I don't know that there's a simple answer to that. I think one of the things that as a founder is that you have to analyze all of the variables. And so, first and foremost, you're building a company, and you have to get to profitability, or you will not have a company. And so when I'm making decisions like that, I always keep in mind, okay, I have one goal. I have to get to profitability. I understand that there are many ways to get to profitability, but then I look at, okay, what does the path look like to profitability? What do I feel comfortable with doing as well? Mm-hmm. Also, in looking at the kind of the subset of the market, that I'm addressing, and then really focus on that. And I think the key takeaway here is focus, because the other thing that will happen is that with all of that advice will also come many ways of doing the same thing, or you will also be presented with many opportunities to make money. And then what happens is that you become very defocused. So you will sit in a meeting with, let's say, a health insurance company, and you want that health insurance company as your client. But when you're sitting in that meeting, they talk about a solution that is, off in left field. And if you had that, of course, they would buy it from you. So then what do? You go back, you tell your team, okay, this is what we're doing. We're going to get this client. If we only have this feature, that feature, and this. And so you create it and you put those features in. Then the health insurance company says, oh, no, we changed our mind. I mean, the person that sponsored that has been fired or whatever. Right. And then you're like, okay, we lost time. We lost money in putting it together. And now it's not something that anyone else wants. But had you stayed focused, and maybe that health insurance company, it wasn't a fit, but the other health insurance company was ready to work with you. So I think that really it's about understanding what your true mission is and staying focused on that.
I call it shiny new opportunity syndrome.
I love that. I'm going to write that one down. I love it.
Like shiny new object, right?
Yeah.
New opportunity syndrome. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. And don't you think that it's like even more prevalent today in this COVID climate that we're living in? It seems like it's so, there's so many different changes that have taken place, and people there, a lot of decisions are being made on not necessarily how can I get to I just want to survive, right? It's not even, about thriving and building a wildly successful company that helps millions of people across the world, but I just want to be able to survive this crisis. And then to the example that you said, maybe kind of veering from their original mission and purpose to be able to kind of make do in the interim. What's your thoughts around that?
So that is very important. And so I'm fortunate in that I have been on the judging panel for quite a few COVID-19 startup competitions.
Yeah.
And so I've seen a lot of pitches and a lot of startups that are addressing the COVID-19 situation. And the problem is that they will change their product because startups that are playing in also the telehealth or virtual care space are getting this a lot.
Yeah.
Is that their solution really doesn't fit, but they are going to completely change what they're doing to address the COVID-19 situation. And so I've said to them that, you know what, COVID-19 will eventually be under control. It's not completely eliminated. So then what will happen to your business? Mm-hmm. So you have to, and again, this goes back to your mission and your focus, or this shiny new opportunity syndrome. Love it.
Yes.
And and your business has to scale. So if you're designing something that is for COVID-19, make sure that, and of course, if this is your mission and your focus, make sure that you are designing it so that it addresses future public health crises, not just specifically the COVID-19. But that's a big problem now because there's a lot of money that's getting thrown around with COVID-19 and COVID-19 innovation and things along those lines. And of course, startups, they're grants also, so it's free money. So you're going to get $100,000, to do this. Hey, why not?
Right.
But that's very short-sighted because in the long term, you will be out of business.
It's like the telehealth gold rush. Right? Every like droves of people coming in to find their telehealth gold.
Yeah.
Yeah. So,
which I like, of course, being in telehealth, but
right. You're like, no, I was here before it was cool.
Yeah. This is my river, get away from it.
Right, exactly.
Yeah.
So when you think about, this current climate, what do you think some of the myths or pitfalls are that, guidance that you would want to share with our listeners and viewers? Things to be watchful for, similar to what we're talking about.
Yeah, and so I really want to stress on what I was saying is that this period will end. Mm-hmm. So stay focused on what you are doing, and don't get distracted with all of the free money that is getting thrown around. Really stay focused. The second thing that I think that we should consider is that health as we know it is changing forever, right? So the way that we deliver healthcare, the way that we create the speed at which we create vaccines, the way that we access health, I mean, you name it, health is completely changing. So keep sight of that, so don't get behind the curve, mm-hmm. but make sure that you do stay focused, and you will be okay.
Mm-hmm. So as someone who is involved, with this in many different countries, What do you see happening around the world from a global digital health standpoint? And, what are some of the market trends that you think that we should be on the lookout for?
So one of the things that I see is collaboration. And so collaboration from governments collaborating to startups collaborating. I really think that the the world is becoming a smaller place.
Yeah.
But if we look at the the vaccines and the tests that that the governments and other large companies are creating, it's coming from data that has been shared. And in the past, governments have been very protective over that. So that's a trend that I see is collaboration. And it's quite interesting because I was sitting on a panel about the future of medicine, and somebody asked me what I thought the future of medicine is. And I said, a global health system. And I go, what do you mean a global health system? And I said, well, it's one health system, and it doesn't matter if you're a citizen of the United States or you're a citizen of a European country, you have access to, all the same providers, etc. And then they kind of laughed. And it's like, well, that is never going to happen. And I said, well, we already have the technical ability to do it. The only barrier that we have are, of course, the individual country regulations and stuff like that. Then COVID-19 hit, and then governments started collaborating with each other.
Right.
I don't think it's so far-fetched. I don't think it's so far-fetched.
No, I don't think so either. But, obviously it would take a lot of work. But, just like anything with telehealth, with, all remote patient monitoring, with all of these digital health solutions that have been around for so long, where the pandemic has kind of been, a stick of dynamite and some gasoline from an acceleration standpoint, I think that it certainly can be what you described as well. Prior to the pandemic, let's say that maybe it would have taken us 50 years to get to that single health system around the globe. And we've kind of just jump-started maybe 2 decades here.
I know your listeners are going to wonder, oh, this crazy Lee Greene talking about a one global health system.
Exactly.
It's not going to happen tomorrow, of course, but...
in a few years, we'll pull it out of the archive and we'll go, oh my gosh, you were right.
Yeah, exactly. I'll say, see? I'll be looking down from the heavens above. See, I told you down there.
Right, exactly. So what are some additional lessons learned that you can think of along the way as we kind of wrap up here?
Lessons learned. Don't be afraid to ask for help. I mean, that might sound a bit corny, but also we as founders, and this goes back to us being under incredible stress and not knowing, founder and entrepreneur mental health issues is very big. And the problem is we feel like, and this definitely has been my case, where you feel the incredible responsibility. Mm-hmm. You feel like if you fail, the world is going to end. The majority of the time, your family has put money into what you're doing. I mean, your spouse is complaining because you've mortgaged the house. So I think the biggest lesson is like, you have to keep yourself fit, and that means mentally fit. So that also means, sharing with people who understand what you're going through. And again, I mean, this kind of goes back to collaboration.
Yeah. I mean, I think you're definitely right. That support system is such a deal breaker and plays, I think, such a critical role in our mental well-being as we go through this process, because it's such an emotional roller coaster. sometimes minute to minute, not even like quarter by quarter. You get
That's right.
hi, and then like in the same day that afternoon.
Yeah, that's right. That's right. I mean, and never taking a break, and like for me, I think I feel guilty when I take the weekends off, and I've been talking to my partner now. We're going to, for literally the first time, I'm attempting to take 2 weeks off at the end of August. And I'm telling everyone that I'm not going to be available, and I feel so bad.
Right.
It's like I shouldn't do this, So.
No, I agree, but there's something I think that in the future we'll look back on this time and we'll be able to probably articulate it a little bit better. But there's something else going on here. I mean, of course, there's a global pandemic and there's all this social injustice, and then there's the political climate, right? There's just so many different things that we are not necessarily, dealing with before, besides any personal and professional challenges that's going on. But there's something else that's driving, I think, this overstressed kind of burnout by everyone. Even these mastermind groups that I'm part of, with other executives and entrepreneurs, we're all talking about how we feel fried and burned out more than ever, and so do our teams. And so what are we doing to kind of help them and help ourselves? I had everyone on our team this week, but believe it or not, so we do like a weekly call with everyone on the team where we're kind of planning the work for the next week. And I told everyone this week, just being accountability partners for each other. What are two things, like on Monday, plan to report 2 things that you did for self-care. Could be really small, and nobody's going to, judge you if you didn't, but at least if we have that in place, then we might be a little bit more apt to investing in ourselves. Because it seems like that whole self-care is kind of like, ooh, touchy-feely for those people over there, right? Kind of going back to the advice we give other people, but we don't take ourselves. So
but I think that's great. In my organization, we also follow a certain methodology. So when we have our meetings, we always start first with everyone has to say something positive about their personal life, positive about the business life. And that's interesting because it really puts you in the right frame of mind before you start the meeting. And then you realize, okay, well, there are actually positives that are going on at the moment.
Yeah, that's awesome. I might steal that from you, Lee, because it's kind of just creating that gratitude list, if you will, without doing the actual exercise. You don't have to call it that. No, they just think that you're chitter chatting, but you're really very strategic about what you're doing.
And the other positive that comes out of that. So if you have a meeting and somebody is in upset about something, or they're upset with somebody that is going to be in the meeting, it also kind of recenters them, because they first have to stop and they have to think about, okay, what is my personal positive? And it's not so easy. I mean, I sit there and I think, gosh, what is good going on, So
and I get back to you in 30 minutes.
Yeah, exactly.
Oh, man. Yeah, and you imagine the serotonin, the dopamine that's kind of being created just with those 2 questions.
And you also get to know each other as well. So I find that you feel more like a unit, or dare I say a family, and more connected because you hear other people's positivity.
Yeah. So is that something that you adopted since COVID, before COVID? Is it something that you thought was important with a distributed workforce, or is it just something that's just part of your leadership?
So it's something that is just part of my leadership, and it's actually something that I was introduced by some colleagues. It's called the Entrepreneurial Operating System. So it's an actual methodology. I didn't know if I should say the name or not, but and and it's called the L10. So it starts exactly that way. And so we were doing it before COVID.
Okay. All right. I'll have to check it out.
Yeah.
I don't have to bleep that out though. Right.
Okay.
No, I'm saying I don't have to bleep that out, right?
Oh, no. I don't know. I don't know them. I don't. Other than, hey, I'm using your system.
Yeah. Oh my goodness. Yeah. What a good, promo for them, right? Yeah. I'll definitely check it out. That's awesome. So, anything else that you want to say before we wrap up?
Yes, I want to thank you for this podcast, because I also listened to your shows, and before this I went back and listened, and it's fantastic. It really is. It's very, very helpful. So thank you for making this information available to the audience. It's very valuable. Thank you.
Thank you so much, and for those kind words, and thank you for being a guest today. I knew this was going to be a fantastic episode, and you definitely didn't disappoint.
It was great.
So how can folks get a hold of you if they want to reach out to you after the show?
They can send me an email, lee.greene@healthinc.io.
Perfect. Awesome. Well,
and Greene has an E at the end.
Oh, that's important.
Greene at healthinc.io.
Awesome. Well, thank you so much for joining me today. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.